Hi, I'm Dr. Marcel Williams, the Health Access Specialist with the National Black Trans Advocacy Coalition. For Men's Health Week 2022, I want to share some important information about a cancer screening that is relevant for trans masc individuals and trans men. Cervical cancer begins when healthy cells in the cervix develop mutations in their DNA. The mutations tell the cells to multiply out of control, and the abnormal cells form a mass called a tumor. Some strains of the human papillomavirus, or HPV, which is a sexually transmitted infection, play a role in causing most cervical cancer. HPV is very common, and most people with the virus never develop cancer. In some people, HPV survives for years, sometimes 10 years, increasing the chance for cervical cells to become cancer cells. Early stage cervical cancer usually doesn't have symptoms. Signs and symptoms of more advanced cervical cancer are frontal genital bleeding after receptive penetrative intercourse, pelvic pain or pain during frontal receptive intercourse, bleeding between periods or after menopause, heavier than normal frontal genital bleeding, or watery, bloody frontal genital discharge that may be heavy and have a foul smell. For people who have a cervix and are taking testosterone HRT can cause changes in the cervix that appear abnormal. This does not necessarily mean that it is cancer. The World Professional Association for Transgender Health, or WPATH, defers to specialists with experience with certain reproductive organs. The American College of Gynecologists and Obstetricians, or ACOG, recommends the PAP test and HPV test to screen people for cervical cancer and the HPV vaccine for cervical cancer prevention. The PAP test is a test where the doctor collects cells from the cervix to see if they are normal. This is a test where the doctor uses a speculum. The HPV test looks for infection with strains of HPV that are linked to cervical cancer, and it can be done at the same time as the PAP test. Talk to your doctor to see if you qualify for the HPV vaccine because it varies by age. According to the ACOG 2021 guidelines, people under 21 years old do not require screening. People who are 21 to 29 years old should get a PAP test alone every 3 years. HPV tests alone can be considered for those who are 25 to 29, but the PAP test is preferred. For people who are 30 to 65 years old, there are three options. First is to get a PAP test and an HPV test. Having both these tests together is called co-testing, and co-testing would occur every 5 years. For option two, you can get the PAP test alone every 3 years. For option three, you can get the HPV test alone every 5 years. For people who are over 65 years old, you don't need screening if you have no history of cervical changes and a certain number of negative PAP, HPV, or co-tests. There are a few caveats. You still need screening if you have already gotten the HPV vaccine, and you still need screening if you had a hysterectomy and your cervix was not removed. There are some exceptions to the rule. You may need more frequent cervical cancer screening if you have HIV, you are immunocompromised, you had cervical cancer in the past, you got a hysterectomy and the cervix was removed, and you have a history of cervical cancer or moderate to severe cervical changes. It's not easy for trans mascs and trans men to access affirming medical care. Reproductive health is a difficult topic for the trans community, but it's important to get regular health screenings because early detection saves lives.